To enter university in Australia from an international student point of view, you have to
สวัสดีค่ะเพื่อนๆก็แฮปปี้ซัตเทอร์เดย์นะคะส่วนวันนี้นะคะเราก็จะไปปีนเขากับเพื่อนเรานะคะที่เมืองเล็กๆเมืองหนึ่งห่างจากบริสเบนประมาณชั่วโมงครึ่งนะคะเรียกว่าทูมบ้ามันเป็นภูเขาที่เรียกว่า Tabletop Mountain นะคะมันก็จะอยู่แบบข้างในหน่อยนะคะหรือว่าเขาเรียกว่า Inland อีกชื่อหนึ่งของเมืองนี้นะคะก็คือ Garden City นะคะเพราะว่าทุกปีเนี่ยทูมบ้าเขาจะจัด Carnival of Flowers นะคะในช่วงฤดูใบไม้ผลินะคะหรือว่า Spring ซึ่งก็ใกล้เข้ามาแล้วนะคะก็จะจัดช่วงเดือน September นะคะตั้งแต่ต้นเดือนจนถึงปลายเดือนเลยเดี๋ยวเราจะลิงก์ไว้ข้างล่างนี้นะคะส่วนวันนี้นะคะเราก็มีนัดกับเพื่อนด้วยนะเพื่อนคนนี้ของเราเขาเป็นหมอเด็กนะคะเป็น Paediatrician ก็อยู่ในระดับของ Advanced trainee นะคะเราก็เลยถือโอกาสอยากจะสัมภาษณ์เขานะคะส่วนคำถามนะคะมันก็จะมีประมาณว่าคือเพื่อนเราเนี่ยเขาเป็นคนมาเลเซียใช่ไหมเขาก็แบบว่าจบการศึกษามัธยมที่นั่นนะคะหรือว่าไฮสคูลแล้วก็สมัครเข้าเรียนโรงเรียนแพทย์หรือว่า medical school ที่ออสเตรเลียนะคะเราก็จะอยากถามเขาว่าขั้นตอนการ apply เนี่ยมันเป็นยังไงนะคะสำหรับเด็ก international นะคะซึ่งจริงๆแล้วมีน้องๆหลายๆคนนะคะเข้ามาถามเรานะว่าเนี่ยสนใจอยากจะมาเรียนหมอที่ออสเตรเลียกำลังจะจบมัธยมปลายแล้วจะทำยังไงก็ลองไปฟังดูนะคะแล้วเราก็อยากจะถามเขาเกี่ยวกับมหาลัยที่เขาเรียนนะคะซึ่งก็คือ U of New South Wales นะคะว่าcurriculum ของมหาลัยเนี้ยมันเป็นยังไงบ้างนะคะเรียนกี่ปีอะไรพวกนี้เป็นต้นแล้วหลังจากที่เขาจบเนี่ยตอนสมัครทำงานเป็น intern มันมีอุปสรรคอะไรบ้างนะคะเพราะตอนนั้นเพื่อนเราเนี่ยเขาก็ยังไม่ได้เป็น PR เนาะหรือว่าตอนนั้นเนี่ยเขาถือวีซ่าอันไหนอยู่นะคะก็ไปฟังกันแล้วก็จะให้เขาเล่าเกี่ยวกับประวัติการทำงานนิดนึงนะคะแล้วทำไมเขาถึงเลือกแขนง Paediatrics นะคะแล้วก็การเข้า training โปรแกรมของแขนงนั้นด้วยโอเคค่ะทุกคนเดี๋ยวเราจะไปรับเพื่อนเราแล้วนะคะก็เดี๋ยวค่อยมาเจอกันใหม่นะคะทุกคน Do you want to introduce yourself first?
Hi, I'm Sue. I'm Bet's friend.
Yeah, we're on our way to Toowoomba. How did you get into the medical school in Australia?
So basically, I'm from Malaysia, so that's where I grew up and I went to school. And to enter university in Australia from an international student point of view, you have to complete some form of high school education. And back home where I was in Malaysia, basically what I did is I finished my secondary school education in a public school, and then for the last 2 years I went into a pre-university program in a private college called Taylor's College, and the program is called A-Levels. A-Levels is a equivalent high school, the last 2 years of high school back in the UK. So that program, we have that in private colleges in Malaysia. So I completed that, and then based on that certificate, I use it to apply to medical schools in Australia. Next question is, how did you pick which medical school to apply for, and why did you pick UNSW?
Yeah.
I think I've had a lot of encouragement from my parents to have a university education overseas. And at that time, my preferences were either the UK or Australia because my dad had experiences studying in the UK. The reason why I thought about Australia is because we have relatives there, so in that way I will get some kind of family support. So yeah, that's why I chose Australia.
Okay.
The medical school program UNSW back in my time is an undergraduate program, so you don't need to have a basic undergraduate degree prior to entering that medical school, and it's 6 years in total.
Okay.
In terms of how the curriculum works, it's divided into 3 phases, so phase 1, 2 and 3. Phase 1 is more lecture based, where you mainly attend lectures at the university grounds of the time, but then you get some days to attend placements in the hospital, so like maybe once every fortnight or something like that. ฉะ nothing regular. And for that first 2 years, they divide it into different terms, and each term is based on a particular subject. So it might be, say, a pediatric term or geriatrics, and then, yeah, based on that subspecialty, they will then base those lectures around it. So those lectures will be didactic lectures, and then you also do lab work as well. Yeah, so that's phase 1. And then phase 2, 1 year of it is a research year. So in UNSW, we get to do a whole year of research, which is important in medicine because when you practice medicine, you do want to do evidence-based medicine. So it's an important skill. And then the other year, you get to attend hospitals more often compared to phase 1. And again, they divide it into terms and it'll be different subspecialties. You still do have to attend some lectures as well in the university. And in phase 3, the last 2 years, that is fully hospital-based, where you attend hospitals every day. And that's when you get to be attached to a particular medical team, and you can tag along and shadow the doctors and find out more about what the work is involved. I like the program there because the way they make it work is that they introduce you to the hospital environment right from the beginning, and then they gradually increase your exposure. And then what they really focus on as well in UNSW is not just on your basic sciences knowledge or medical knowledge. They also try and make you a more all-rounder, because it's not all about like just treating the disease, it's how to treat your patient as a whole. So yeah, really taking into account holistic approach, like the social factors of the patient as well and how it affects their condition. Did they accept a lot of overseas students?
Yeah.
They do. Like when I was there was about 20 or 30 of us.
How many people were in your class?
So the whole cohort in my year was about 250 students.
Okay.
After graduating, was there any obstacle getting an intern position? Yes, so as an international student, you will have to hold a Australian student visa to be able to study in Australia. In terms of applying for a medical internship, so the way the application works is, for my time, state-based. So every state recruits their own interns. You have to apply to that particular state if you want to get an internship spot in that state. And the way they prioritize the applicants is that they will prioritize their own local graduates first who originate from that state, and then the next priority would be other Australian graduates from other states. And then the next one will be permanent residents, and then unfortunately international students were the last priority group. So at that time I did apply to a few states. I applied to New South Wales, Queensland, Western Australia, and then South Australia as well, just to maximize my chances of getting a spot. And yeah, it was really tough. I didn't get an offer until the very last minute from Queensland.
And what about the visa? Did the visa change as you applied for the job as well?
At that time, I graduated in December, and then job starts in the start of February. And you can still apply the job while you still hold a student visa. And my student visa at that time finished in March or April for that year. So I was still able to like apply jobs and still stay in Australia until the end of the student visa. But then if you want to start employment, like say February, you have to apply for your work visa.
Okay. And that process didn't take very long?
No, as long as you got an offer and an employment contract, you use that to apply for your work visa. Next question. After internship.
So we know that you've been working for a few years now. Can you just briefly describe your journey so far, what you've done?
So I started my internship in Queensland, and I have been working in Queensland ever since for the last almost 10 years now. So my internship year, I went to Bundaberg and Harvey Bay Hospital. And then once you finish your internship, you get your general registration. And for me, after that, I went to a few places. So first year out, you call yourself a postgraduate year 1.
Yeah.
And then my postgraduate year 2 and 3, I was in Redland Hospital. So yeah, that's where I met you. Yes.
That's how we met.
During my postgraduate year 3, I applied for pediatric training. Since my postgraduate year 4, I've been doing pediatrics.
Okay. Maybe tell us a little bit about the program and getting into the program.
Into pediatrics?
Into pediatrics.
Yeah. So for Queensland, so the way pediatric training works is you have basic training and advanced training. Basic training is 3 years at least. And in Queensland, you have to apply to the Queensland Pediatric Training Network. And you can easily find more information on this online on the Queensland Health website. The network training pathway for basic training is for 3 years. When you apply and if you get it, you will get your hospital training for the 3 years. It's all set. They will tell you where to go every year. So you have to do basic training for 3 years. And in your third year, if you have already completed 24 months of training, you then can sit for the exams. And the exams consist of written exam and clinical exam. And once you pass both exams, in your 4th year, you can start doing advanced training. And advanced training is for another 3 more years. Advanced training usually means you start doing your chosen subspecialty, so whether that's general pediatrics, neurology, cardiology, and that's another application process that you'll have to go through. I would say my advice for those who want to look into doing medicine, be prepared to study and work very hard. I guess from an international student perspective, think about the financial side of things, how you can get the university fees paid off, because it's quite expensive. And then also once you finish medical school, don't forget it's also another at least 10 more years for you to go through training before you become a specialist of your chosen choice. But as long as I think if you enjoy doing medicine, you probably think it's worth it. Yeah.
It's a long journey, but I think a lot of things happen along the way to make it like enjoyable.
Yes. Think about why you like it, and I think that will motivate you to work hard and persist. I think it's also good to just make sure that you got your good supports around you.
That's right.
Hope this information is useful for your viewers.
ก็ต้องขอบคุณซูที่อุตส่าห์มาตอบคำถามแล้วก็เล่าประสบการณ์ของเขาให้เราฟังกันนะคะ ถ้าเพื่อนๆชอบคอนเทนต์แบบนี้ก็ช่วย subscribe ให้เราหน่อยนะคะ โอเคแล้วเจอกันที่ Tabletop Mountain นะคะทุกคน